Cameron here, registered physiotherapist. Today I'd like to talk to you about the overemphasis on stretching when a muscle feels tight and how stretching out a muscle might not necessarily be the right correct route to go in terms of feeling more comfortable and having that muscle let go and relax. But before I begin, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So in a lot of cases, right, I'll be seeing a patient, whether they're complaining about hip pain, knee pain, neck pain, and they're coming in and they're complaining about tightness in different areas, and they've been trying on their own, perhaps they've been trying a stretching routine over a long period of time, over months perhaps, and they're really not getting any relief. So what they're finding is, you know, they might stretch throughout the day and maybe get little pockets of relief. So let's say, for example, if they have a lot of hip pain and there's this sensation of tightness, let's say in the front component of the hip. So let's say they do a lot of hip opening type exercises or stretching out their quadricep muscle, so the muscle in the front of the thigh, and yet this tightness feeling, it just doesn't seem to want to go away. And patients come in with a lot of frustration about this, and they're wondering why they can't get any relief. And so what I want to mention here is the fact that with muscles that are really tight, right, in a lot of cases this is occurring because there's an overuse, right, of that muscle in order to compensate for a weakness somewhere else. And so the example, for example, with the hip, right, in a lot of cases there might be an overuse of, let's say, the hip flexor or the quadricep muscle or a muscle called your TFL that attaches onto the IT band. In a lot of cases, these muscles here, they might actually be overusing, right, because there's a weakness in the deep abdominal muscles, the pelvic floor, the glutes. And so you're not going to be able to get relief simply by stretching a muscle that is being overused. In fact, what you want to do is really identify why this muscle won't let go, where the potential weaknesses are, and then work on correcting and strengthening those muscles that at the moment are weak. And then by doing that, all of a sudden, hey, the quadricep muscle or the psoas muscle, it can start to let go, right? Another strategy too, in terms of getting relief from this sensation of tightness, is actually to offload the joint with movement. And the reason we do that is all of a sudden that muscle that's been holding on and being overused, well, when you offload it, all of a sudden it can let go because it doesn't need to support the structure in the same way. So in a lot of cases, right, when I see these patients, they've had this sort of chronic tightness over a long period of time. Again, what I'll try and do is identify, number one, hey, where are these areas of weakness, and try to give a specific program, a strengthening program to isolate those muscles. And then number two, hey, here's a strategy as well when there's an overuse of these muscles by simply doing an offloading exercise with movement. And that could simply be, in the example of the hip, that could be a ballistic stretch, right, where I'm simply just offloading, right, and I'm moving that hip back and forth. And I really will, in those cases, try to some degree mention, right, that the stretching, it's not going to correct your problem, right? You might get a bit of temporary relief, but in the long run, we really have to identify, again, the areas of weakness in order to get long-term benefit in terms of these muscles starting to let go. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.